Lee Steger here with Westside-Medical. Today we're talking about spinal stenosis and some of the non-surgical techniques our office uses to help with that issue. We like to use the reverse hyper by Westside-Medical. I like it because it really tracks out the spine as well as it works the deep erector muscles. So we talk about spinal stenosis. What spinal stenosis is, if you zoom in on the vertebra, spinal stenosis is the narrowing of this vertebral canal here, or the spinal canal. And why it narrows is there's a couple reasons. When you have some disc degeneration, you lose hydration in this disc, which causes this here, the annulus fibrosus, to kind of bulge out, kind of like a flat tire. And this bulging compresses the spinal canal, as well as you have a ligament here, the posterior longitudinal ligament, that can also buckle, compressing these nerves, causing diffuse pain down both legs, more associated with walking. It's called neurogenic claudication. Another way the spinal canal can become narrowed is through, I like to call it like stair stepping of the vertebra. So if you look at the side here, this here is a vertebral motion unit. Here's a disc. Sorry, this here's the vertebra. There's a disc. Here's the vertebra. This is an example of what a disc herniation would look like. While with stair stepping, you have this vertebra here and this one. This vertebra can slide forward a little bit, and that's going to narrow that canal. And it slides forward because of the deep erector muscles that tie in through here, the deep erector or multifidus muscle. When that becomes deconditioned, you're going to get anterior shearing, which means this vertebra is going to be translating forward, narrowing that canal. So in our office, we like to use the reverse hyper by Westside-Medical because it does a couple things. In the traction portion of the exercise, it's going to traction this posterior longitudinal ligament and stretch that out. And also through the contraction portion of the exercise, it's going to work these deep erector or multifidi muscles. And so the stronger this muscle is, it's going to pull this vertebra backwards, so it helps open up that canal. So let me demonstrate over here. So you look at this skeleton. You have somebody lay face down on the table. The hips are going to go into posterior rotation. That's going to traction out that posterior longitudinal ligament, help open up that spinal canal. And then when you lift the legs back up, it's going to work those deep erectors or the multifidi that cause that stability to prevent the anterior shearing. So I'll demonstrate the exercise here. So you have your patient step up onto the table. You want your pivot point to be the femur head right here. You're going to lean forward, grab onto whatever peg is comfortable. You want to make sure you keep your lats tight and your abdominals tight. This here's the traction portion, open up the spinal canal. Here's the traction portion, working those muscles. And so you just have them go through the motion. You want to go higher volume, like sets of 10 or 15, probably about 3 to 5 sets. So hopefully that helps. Visit us at westside-medical.com.